Welcome back to the deep dive. If you're here, you want to get smart, fast.
And today we're getting into something pretty common, actually.
Yeah, we're talking about urinary tract infections, specifically in postmenopausal women.
Right. We want to dig into why they seem to pop up more often after menopause.
And crucially, what can be done about them when they keep coming back. Those recurrent UTIs.
Exactly. And we're drawing insights today from the folks over at In and Out Urology.
Good source. And this is a real concern, isn't it? The numbers are quite striking.
They are. You see stats like maybe up to 10% of postmenopausal women get a UTI each year.
Wow, 10%.
And for about 5% of those women, it's not just a one-off. It'll come back within the year.
That's significant. And with people living longer, understanding these recurrent UTIs or rUTIs, it's key for, well, quality of life.
Absolutely. And avoiding more serious problems down the line.
So just so we're all on the same page, what exactly counts as recurrent?
Good question. Generally, it's 2 or more infections within 6 months.
Okay.
Or the other definition is 3 or more within a single year.
Got it. And the symptoms, probably familiar to many.
Oh, yes. That burning feeling when you pee is classic. And feeling like you need to go all the time, that urgency.
Right. Sometimes even leading to incontinence, unfortunately.
Exactly. Not pleasant at all.
So, okay, what is it about menopause that flips the switch?
Yeah.
Makes women more vulnerable?
Well, there are a few interacting factors. There's just the natural process of aging itself.
Sure.
Often, maybe not drinking enough water. Dehydration plays a role.
Mm-hmm.
And then, the big one, the hormonal changes that come with menopause.
Estrogen, right.
Precisely. That drop in estrogen is really significant for the health of the bladder and the vaginal tissues.
How so?
When those estrogen levels go down, the tissues can get thinner, drier, less elastic,
Okay.
which basically makes them more susceptible, more easily irritated, and, yeah, more prone to infection.
That makes a lot of sense. Okay, so if we know that, what are some, practical things someone can do? Lifestyle changes.
Yeah, lifestyle stuff can definitely help move the needle.
Yeah.
Hydration is key.
Water intake.
Right. Aiming for maybe 60 to 80 ounces of water daily.
That's quite a bit.
It is, but it helps flush the system. Some even suggest adding 4 ounces of fresh lemon extract.
Interesting. What else?
Just staying active. Ambulation, even regular walking, helps overall health, including bladder function.
Okay. And diet, does that come into play?
It can. The advice we saw suggests maybe moderating non-dairy animal products and potentially increasing citrus intake. Think oranges, grapefruits.
Okay, interesting dietary tweaks. Now, what about the things you see on the shelves? Over-the-counter remedies.
Right. There are quite a few options people try.
Do any of them actually, pan out?
Well, some women find certain things helpful. Vaginal pH strips, for instance.
To check the balance down there.
Exactly. And there's even a suggestion, if the pH seems off, to use a tiny bit of skin olive oil near the urethra nightly.
Olive oil. Huh. Okay. What else?
The usual suspects. Sugar-free cranberry pills are very popular.
Yeah, hear about those all the time.
D-mannose is another one that gets mentioned a lot. It's a type of sugar thought to interfere with bacteria sticking.
Right.
Probiotics, too. The idea being to help maintain a healthy balance of vaginal bacteria.
Makes sense.
And vaginal moisturizers, like Replens or Refresh, can help with dryness, which is related to that estrogen drop.
Okay, so quite a few accessible options to explore. But what if those aren't enough? What do doctors offer?
When things are more persistent, yeah, prescription treatments come into play.
Like what?
Estradiol cream is a common one. It's applied locally, right around the urethra, usually just twice a week.
So targeted estrogen replacement.
Exactly. Helps restore the health of those local tissues directly.
And what about antibiotics? I hear about those for prevention sometimes.
Yes, that's another strategy. Low-dose antibacterial suppressive therapy.
Meaning?
Taking a small dose of an antibiotic regularly, maybe daily or after intercourse, to prevent infections from starting.
Okay. So creams, maybe preventative antibiotics, anything else. Wasn't there something about physical therapy?
Oh, absolutely.
Yeah.
Pelvic floor physical therapy can be incredibly helpful.
How does that work for UTIs?
Well, strengthening those pelvic floor muscles improves bladder control, support, and overall pelvic health, which can reduce risk factors.
Okay.
It typically involves a course of treatment, maybe 6 to 12 weekly sessions.
And are there specific places recommended?
The source mentioned a couple in New Jersey, actually. Jersey Shore Pelvic Health in Manahawkin
Okay.
and practically perfect physical therapy in Galway,
Yeah.
just as examples of where to find specialists.
It's good to know. So it sounds like a really multifaceted approach: pills, creams, exercises.
Exactly. And ongoing medical management is part of it, too, for people with recurrent issues.
What does that look like?
Regular office visits, obviously.
Hmm.
Sometimes periodic imaging, like an ultrasound, to
Mhm.
check the bladder and kidneys.
Hmm.
Regular urine tests, urinalysis to monitor for infection.
Right.
And in some complex cases, maybe even a 6 or 12-month, 24-hour urine collection.
Wow, okay. To get a really detailed picture.
Yeah, to understand kidney function and identify any other contributing factors.
So wrapping this up, the main takeaway seems to be, yes, rUTIs after menopause are a significant issue,
Definitely a concern.
but there's actually a wide range of strategies, from really simple lifestyle changes all the way up to specific medical treatments and therapies.
Absolutely. It's not something women just have to, live with. There are options.
It's about understanding the why and then working with a doctor to find the right mix.
Precisely. Tailoring the approach.
Which leads us to our final thought for you listening today. Given everything we've discussed, from water intake to estrogen cream, what single lifestyle change do you think might offer the most immediate benefit for your urinary health journey after menopause?
That's a great question. And building on that, what further questions does this bring up for you to maybe discuss with your own healthcare provider?
Definitely worth thinking about. And if you do have specific questions or concerns prompted by our discussion, the number provided by the source is 609-507-4961.
Having those conversations with your doctor is just so important.
Couldn't agree more. Thanks for tuning in to The Deep Dive.